in Chinese medicine, you feel the pulse, you look at the tongue, you look at people's voice, even their skin complexion or their habits. You talk to them about their health history, what they do every day. Then you understand their whole picture of what's going on inside their body.
Hey, it's Rocky. Welcome to Richer Soul. Today, my guest is Dr. Yi Song. Raised in a family with 17 generations of Chinese medicine, trained in pathology at Brown University, and now one of the most unconventional voices in regenerative health.
Imagine it's 12 months from now, and you've achieved your major life goals. How does it feel to be in the best shape of your life? To wake up energized, excited about the day? To have great relationships and friends who support you and propel you forward? How does it feel to have an excess of money, to be able to make the choices you want? To be fearless and open to trying new adventures? Imagine being connected to the universe and it providing everything you desire. It's possible over time, and your past does not dictate your future. The only thing holding you back from this vision is you. It's time to take control of our thoughts and use them to our advantage. Welcome to Richer Soul, where we achieve our dreams and bring balance to health, wealth, relationships, time, and spirituality. If you have not had a chance to listen to episodes 1 through 9, I encourage you to go back and listen to the framework behind Richer Soul and how to create the life of your dreams. You can also find all the show notes for this episode at richersoul.com.
Most of us have been through the medical system. Tests, referrals, prescriptions, we leave with an answer and a quiet feeling that the real question never got asked. Dr. Song walked away from a molecular research career because she realized you can spend a lifetime studying one signaling pathway and still never understand what causes disease. She went back to a philosophy that's 6,000 years old and found that it was asking better questions than the lab one. The conversation covers body constitution, stem cells, the Taoist root of unhappiness, and why your reference range may have nothing to do with your body's actual normal. If you've been managing symptoms for years without getting to the source, today's episode is for you. Let's meet Dr. Song and see how it's done. Welcome to Richer Soul, Dr. Yi Song. It's great to have you join us today.
I'm so happy to be here.
And I'm excited to learn from you today. We always like to start at the beginning. What was it like when you were growing up, and how much did your family and school teach you about money?
So I didn't grow up with a lot of money, but my family was comfortable because both my parents were working in educational field, and my father was a professor in Beijing Institute of Technology, and my mother was working in the Educational Research Institute run by the government. I did learn from them early on that you should spend what you have, not overspending. So basically, I like having a simple life, not too fancy, and then to the point, like, because your income is not always, probably fluctuates. And then if you're so used to spending big, then it's more difficult to scale down than if you're always not spending big, then it's very easy to get by anytime, right? So basically that's my lesson from my family, because my family always teaches me you don't want to overspend what you have, and then you always want to save something so that you save for your rainy day.
Did you learn anything in school, or?
I don't think so. No. Because I grew up in China, and then it's communist. they teach a lot of communist ideology. So the communist ideology is actually not about private property. You know, when I left China around 1997, that was around the time that they started having a lot of private enterprises or private businesses. But before that, everything was owned by the government.
So money really wasn't a concern.
You cannot say it's not a concern, but because back then, most people, the communist ideology, basically, they think you should just be content what you have from the government, and then nothing is private, and then everything is owned by the government, and you just do your work. That's it. I think that's a communist ideology. But of course, now in China, it's totally different. It's basically capitalism.
That China has dramatically changed over the last, 50 years, even in the last 25, but it has been a very big shift of what they've gone through culturally.
Exactly. So have you been to China? Do you do business with China?
I have not been to China, but I can look at the economic stats and realize in the 1970s, we literally bought nothing from China. And then we bought everything from China. And I know that China has also grown their infrastructure. They've moved from an agricultural to a manufacturing. And today, people talk about bringing manufacturing back to the US. The thing is, China's much smarter about manufacturing than we are because we stopped doing it. When you don't have experience doing something, you lose the skill. And I think there are parts of that skill that we've lost that China's very good at. But again, we're in a whole different shifting regime again. So I don't know what the future will be and what happens. The other thing that's interesting with China is you now have a major demographic shift. You had so many people and now the population's declining, and that creates its own set of problems.
Exactly. So they don't have enough labor for the manufacturing.
Well, supposedly it's coming back to the U.S., and it's going to other countries, so who knows?
But in the U.S., the population is aging too.
It is. The population is aging. But here's the thing, and this is what people don't realize. When manufacturing comes back to the U.S., it's not going to be labor intensive. It's technology and machine intensive, not people. So you walk into a factory, it won't be 1,000 people. There'll be 20, 30 people running a massive factory. So that's kind of the shift. I think that'll be there.
But then China can make that kind of shift too, right? So
they can. Yes, they absolutely can. And they probably will. There's no doubt about it.
That's why, right now the race in AI, it's like.
It is. And so we'll see what happens. I stopped trying to predict things because I usually get it wrong. So what prompted you to go into medicine?
Oh, I always wanted to be in medicine, even when I was 6 years old, because I came from a family with 17 generations practicing Chinese medicine. And my grandparents on both my mother's side and my father's side, they are actually in Western medicine. So ever since I was a child, I was always interested in learning about how things work, especially a human body. So that's why I think I always wanted to solve fundamental root cause of disease. That's why I came to the United States to study pathology, because I thought pathology was studying the mechanism of disease so I can solve the fundamental issues.
And we'll talk about that. You learned through Chinese medicine, and one of the things I've learned in Chinese medicine is they will take your pulse, they'll look at your tongue, and from that type of thing, they tell you what the problems are. And here in America, we spend millions on tests and we still don't know what the problem is.
Exactly.
How does that work?
I think the difference is your body is a garden. That's one of the principles I talked about in my book. So Chinese medicine look at your human body as a interconnected system, even connecting with the universe and the earth. So it's not isolated parts like shoulder, knees, heart, kidney. Everything is connected. So that's why when you diagnose in Chinese medicine, you don't just diagnose the symptoms. It's actually you're looking at the whole body's balance, the yin and yang balance, and then the organ balance, like between the digestive system and the heart. So a lot of times when you have certain problems, it may not just be the local issue. It can be problems originating from the whole irrigation system in the garden. So that's the difference between Chinese medicine and Western medicine. And when we do all these tests, they are also isolated. You're only testing what we know. And even the reference range is arbitrary. It's not like something like cholesterol. We have been studying and researching and having so many different medications for cholesterol for the past 50 years. And the range, normal range for cholesterol is very debatable because sometimes it may not be what you think it should be. And then even sometimes they say yours is not normal, but actually maybe it is normal for your body, but it's not normal for the other person. So Western medicine is now very individualized. It's like one size fits all. And then, okay, for cholesterol, let's just take this medication. For blood pressure, let's put this medication. So they don't really look at each individual person. But then in Chinese medicine, you feel the pulse, you look at the tongue, you look at people's voice, even their skin complexion or their habits. You talk to them about their health history, what they do every day. Then you understand their whole picture of what's going on inside their body. So a lot of times their problem actually originated from maybe certain stress they've had for the past 10 years that accumulated. And then the certain stress causes a digestive system weakness. And then from digestive system weakness, you can have lung conditions, you can have other conditions. So that's the difference.
So when you notice that, how do you treat somebody with Chinese medicine versus the way we do it in Western medicine?
So if we notice somebody has, say, like I said, if somebody has long-term stress and then you want to address that to help alleviate the digestive system symptoms, that's what we do. Because in Western medicine, if you see somebody has digestive system weakness, then they will say, okay, you have acid reflux, take this proton inhibitor. If you have stomach ulcer, then take this medication. Then they don't really look at where the digestive system weakness comes from. And a lot of times when people have all these things, it was because they had long-term stress acting on the digestive system. Then you need to address that stress level to alleviate the digestive symptoms. Because if you only use medication to treat acid reflux, a lot of times it doesn't work because the root cause is not addressed.
And most of those meds seem to have a lot of side effects and a lot of other issues that people don't realize for years what they're doing. And again, like you said, they're not fixing the root problem. They're covering up the symptoms.
Exactly. Like a good example is proton inhibitor for acid reflux, because a lot of people, they take proton inhibitors and sometimes you ask them, does it really help your acid reflux? Some people say yes. Some people say, I don't really know, but I take it anyway because I have acid reflux and my doctor just tells me this is the only thing I can do. So then what are you taking it for? And plus, a lot of recent studies have shown that proton inhibitors is the worst medication you can take because it actually affects your body's mitochondrial function. It doesn't really fix your acid reflux, and then it causes your digestive system to weaken further. So a good example to you is like, I was born with digestive system weakness from birth, but I don't have a lot of symptoms because I take care of myself and I do the right diet. So I don't have any acid reflux symptoms. However, like a year ago, actually about 6 months ago, all of a sudden I started having this coughing fit, like from time to time. And I wasn't sick. I don't know why, but I just feel ticklish on my throat and I started coughing. So it goes on for like 4 months. And then finally I went to see a throat doctor, and the throat doctor told me, oh, you have acid reflux that's irritating your throat. That's why sometimes you feel ticklish in the throat and you cough. And the reason is because your throat is irritated from your acid reflux. But I don't have any symptoms. I don't feel anything. So she told me, oh, you have to take this proton inhibitor. So I decided, if I know this is acid, because I didn't have any symptoms, so I didn't know it was caused by that. So now I know it's caused by that. So I started doing some other treatments. Like, for example, there's a very good alternative treatment for acid reflux is to use alginate from seaweed. And they form a layer in your stomach to prevent the acid from going up. So I tried that for the past 3 months. It worked very well. So I stopped having that coughing problem. So you think about this, like most people, if they don't know about it, then they would just listen to their doctor and take the acid reflux pill, which doesn't really fix their problem. It's not fixing the root cause.
You said you came here to study the root cause and you thought it was pathology. What happened?
I was studying the DNA. I was studying the molecular biology, studying the cell signaling molecule. And now I realized one main reason why I stopped doing that, I switched to doing Chinese medicine. One reason was because I realized this kind of study really doesn't solve the mechanism of disease, the root cause of disease, because we're studying one molecule. And a lot of times you actually study the molecule, the interaction in the cell signaling pathway, only a single one for the rest of your life. And then you basically lose the sight of the whole picture. You don't really look at other things because that's what you're studying. And also the other reason is I really don't like being controlled by other people about what I can study, because when you study all these molecular interactions in the cells, you have to follow the trend in the research. And then you have to get grant from NIH or other places to support your research. If you don't get the grant money, basically you become unemployed or you are just relying on the university for your funding or something like that. So I really don't like that idea. And also I don't like the idea of not being able to study what I'm really interested in. So that's why I was always interested in Chinese medicine since I was a child because of my family influence. And I was always very intrigued by the traditional Chinese medicine philosophy. So the more I learned about it, the more I realized actually that is a route that will fulfill my dream about treating the root cause of the condition and helping more people. So that's why I switched.
So you've been trained in both. Do you use parts of both, or are you strictly to one side or the other?
So for the past 25 years, when I run my clinic in Boston, which is mostly based on traditional Chinese medicine and other holistic treatment modalities, I mainly only use my Chinese medicine knowledge. But of course, because I understand the Western pathology better, so a lot of times I can communicate with my patient better because my patients mostly are Americans, Western-minded people, but they are open-minded about seeking alternative treatment for their conditions. So when I talk to them, I can actually use the kind of thinking they understand from the Western medicine point of view, and then combine the Chinese medicine philosophy to explain them how they can do things differently to help their health.
Interesting.
But of course, then I started doing stem cells. Stem cells is really considered Western medicine, right? However, it is not because that's why I wrote my book, because I really want people to understand you can actually combine the ancient practice, ancient philosophy with modern technology that benefit your health the most, and then can prolong your life, can prolong your health span instead of just lifespan. And all these things, most of the modern things we're doing now, they actually originated from ancient practices. But it's just because most people, they didn't know about it. And then they think it was modern. Of course, the technology has advanced a lot in the past 6,000 years. But the really basic fundamental knowledge and the philosophy and the approach that really works for our life, for the whole universe, is nothing new. It's like even 6,000 years ago, they were very advanced. They already figured it out. The reason for that was because they were more connected to the natural energy, and they were doing advanced meditation that we modern day people actually lose the contact with.
Do they still do that in China, or have they also lost that as well?
I would say most people in China nowadays, they lost that. But there are people in China who are still having that. So because I started doing meditation because of my family influence when I was like 12. So I understand you really can get into certain advanced stage in meditation. And when you get into that stage, you can actually envision your body's energy flow. So that's why all these meridians, energy theories in Chinese medicine, it was not just developed by somebody out of their brain, like they don't really know anything about. They actually personally envisioned it by meditation. So that's why they could draw out all these blueprints of how things flow. Even nowadays, if you really, maybe a few percentage of the people, they would have that capability. And if they train themselves to do that, they would be able to achieve that. So there's a book published in China. Some people, modern day people, they actually try to do this type of meditation. And then once they get to that stage, they wrote down in the book what they envisioned. And then they also can envision, for example, if you take a aspirin pill orally through your mouth into your digestive tract, then they do the meditation. They can also envision how the medication travels inside the body energetically as well. So that is possible, but it's not like everybody has that capability. And even though you have that capability, you have to culture it. You have to practice on that to be able to achieve that.
It's amazing how much we have forgotten about our history. So I know you mentioned mitochondria before. Most of US-based medicine kind of ignores mitochondria.
Exactly.
Yet it is truly the powerhouse of our cells and so forth. It's somewhat of a symbiotic relationship. Is mitochondria more talked about in Chinese medicine, or is it not a subject of that?
I don't think back 6,000 years ago, nobody in Chinese medicine really knew cellular structure, because mitochondria is part cellular organ in the cell, right? So back then people didn't know about it, but they could talk about energy. And the mitochondria is the organ in the cells that produce energy for the cells. So that's why mitochondria is very important, because without energy production, nothing can happen in the cells. All the chemical reaction, all the transforming reactions in your body happen because of the energy produced by mitochondria. So that's why in the biohacking, in the longevity field now, everybody's talking about mitochondria. So if they want to sell you anything, they will talk about their product helps your mitochondria.
And that makes sense. So what inspired you to write the book, Regeneration Effect, Sacred Wisdom for Staying Young?
So because I started doing stem cell treatment 5 years ago, Of course, initially it was purely by chance. I wasn't even looking for stem cell treatment myself, but I was introduced into this lab in Colombia where I already had the retreat. So from there, I treated my mom, which worked really well for her condition that we couldn't even find very good results from using a lot of traditional Chinese medicine treatments. So that's when I realized, even though Chinese medicine has very advanced philosophy and approaches below it, developed from 6,000 years ago, it also has its limitation because it doesn't have this advanced technology that we have today. But in Chinese medicine, a long time ago, people already started talking about using placenta to treat people, and you can actually get energetically regenerated or renewed with the placenta given to you. So the concept is very old, but the technology is new. So from doing the stem cell treatment to people, then that's how I realized, I really need to teach people about not just using modern technologies thinking you can biohack yourself. You have to understand the ancient philosophy, the ancient approach, and combine the ancient approach with modern technology. That's how you can obtain the best result with the health longevity practices. So I want people to understand that. And then because I already had experience in treating people with ancient Chinese medicine technologies, so then I want to teach people how to combine these together and how to look at things differently. So that's why I wanted to write the book about 2 years ago. But at that point, I really didn't know how to structure this book. I know what I want to talk about, but how do I structure it? So this is actually a process with my publisher who helped me a lot because he told me, if you want to teach somebody something in one day about 5 principles, what are you going to teach them in your book? So that's how I started organizing my thoughts and then came up with the 6 principles. And I think after all these, a year and a half working on this, I think these 6 principles are the essence of how people can combine these principles with the modern technology to achieve the health and longevity.
And what are the 6 principles?
So the 6 principles are: number 1, recognize your body's constitution. Number 2, early prevention. Number 3, treat the root cause. And number 4, tend your body like a garden. Number 5, follow the natural rhythm. And number 6, combine all the methods unique, designed for your body to address your particular body constitution in the right proportion. That's how you achieve the health and longevity.
This episode of Richer Soul is sponsored by the Profit Answer Man podcast. If you're a business owner who wants to scale and grow, increase profits, or want to have strategic conversations around your financials, then check out the podcast. You'll learn how to work less, increase cash flow, increase profits, and build reserves to help you weather storms. It's built on the Profit First methodology of pay yourself first. The Profit Answer Man podcast is a must listen to for every small business owner and anyone who wants to help them survive and thrive. Check it out on your favorite listening platform.
So when you say body constitution, what does that mean?
So body constitution, you can have, basic constitution means you actually inherit it from birth. So that's more similar to the concept of DNA. You inherited your DNA from your parents, and even in the process when you were growing in the womb, you may have your own mutation or something. So basically your DNA composition is your prenatal constitution. But in Chinese medicine, going beyond DNA, we also talk about your own body's yin-yang balance, and then the system, different system like a digestive system, heart, liver, spleen, gallbladder. So in Chinese medicine, like I said, I was born with digestive system weakness. So that was my constitution. And because of my digestive system weakness from birth, I accumulate dampness and heat inside my body. So that's why I always have symptoms of damp heat since I was born. When I was born, I had a lot of eczema. And when I was 2 years old, they discovered some kind of lipoma on my butt. And then even like the acid reflux problem I just told you about 6 months ago, the throat doctor told me basically the reason I started having these symptoms was because I turned 50 last year. So she said a lot of people, the valve in their esophagus, they were already not working well. So, I always probably had this kind of silent reflux, but because I have pretty healthy lifestyle, so I didn't have any symptoms. And even when I started having coughing issues, I didn't have any acid reflux symptoms. But because when you reach a certain age, the valve basically wears out. So then it stopped working very well. So because she told me that, now I start understanding when I was treating a lot of people in the past 25 years, a lot of people were telling me they have acid reflux problem, and then they had to go have surgery for hiatal hernia or even for sub-bariate esophagus. And even after surgery, they still had the problem. They never, otherwise they would not be talking to me trying to fix the problem. So basically, I always had this weakness, even though I pay attention to my lifestyle, pay attention to a lot of things so that I don't have symptoms, but that doesn't mean I don't have that weakness. So that weakness, I cannot change it. I'm not able to change it even through my postnatal life from weakness to strength. That's always there. So that's a constitution.
And the other thing you said is you have to tend to your garden. So what does that look like?
So that means if you have a headache, a lot of people, they just take painkillers. They don't look at why they have headache, right? Or even a lot of women, they would have headaches associated with their menstrual cycles. That's also hormone related. But then if the headache is not bad enough, even though some women I treated, they have migraine every single month associated with menstrual cycle, they would just take stronger migraine headache pills to deal with that. But if you tend your body like a garden, basically you will look at why you're having this problem. So a lot of times when you are having menstrual related headaches or even just headaches without any pattern, it means you have some circulation issue that's causing the headache. So the circulation is like the irrigation system of the garden. It can be clogged somewhere else, not in the head. That's causing this problem that you're having headache. So if you only treat the symptom of the headache with a painkiller, you're not treating the root cause of the headache.
That makes total sense. And I think too often we put Band-Aids on problems. We don't get to the root cause. Doctors probably don't have time to even spend with you anymore to get to the root cause. And so it's a bit more difficult. You have to take ownership of your own health and figure out what it is. When you look at patients, what are the markers or what are the things that you're looking at to help diagnose them or to figure out the root cause?
So I actually combine Western and Eastern diagnosis. Just to give you an example, it's very recent. This person came to me. Actually, they were looking for stem cell treatment because he said he has neuropathy. But if you tell me somebody has neuropathy, most people will think, oh, it's like pins and needles, burning sensation on the feet, on the hands, something like that. But his neuropathy was not like that. His neuropathy is he basically cannot have a lot of sensation on his feet. So he cannot feel his position of the body. And then he tends to fall over because he doesn't have the position sensation on the feet. So that's made me thinking, that's not typical neuropathy. But he said, his doctor, he's seeing like 4 or 5 neurologists. All of them told him he's idiopathic neuropathy. So then I found out this was just a random conversation because I went to do a podcast with his friend and he was there. And then we were talking about autoimmune conditions with stem cell treatment, that type of thing. So then he started telling me, he said, I have Sjogren's. He said, I've already had Sjogren's for 10 years. So then I started thinking, maybe his neuropathy is related to Sjogren's, but I'm not very familiar with Sjogren's symptoms, even though I've seen a lot of people with Sjogren's, but I've never seen anybody like what he has, like, the kind of neuropathy you don't feel your position. So then I had to dig into research a little bit more, and I found out for Sjogren's, for some people, because they're autoimmune conditions, it's attacking their nerve root between your lumbar and sacrum. And that nerve root are the nerves controlling the sensation of your feet and your position of your body. So basically, what's telling me is his problem is from Sjogren's. It's not just neuropathy. It's not idiopathic. But he said he's seeing 4 or 5 different neurologists. Nobody told him that. Mm. So that's my combination of Eastern and Western thinking because I'm different.
You've mentioned stem cells a few times. And from what I've seen, that world is the Wild West. You don't necessarily know what you're getting. You don't know the quality. There's all kinds of wild claims. What is it that brought you to stem cells and what do you use them for?
So like I told you earlier, the first patient is my mother. So because we actually couldn't find any better solution for her condition in her lower leg. And then that's exactly when I was introduced to stem cells. So based on my research, just like anything I do, like this gentleman I mentioned to you about, the neuropathy, the sensation of the feet, I always try to understand the mechanism from both Western and Eastern view. So for my mother's problem, she has familial diabetic history, but she is not diabetic because we have been controlling her diet and everything else very well. So she doesn't have any diabetes. However, because of her genetic composition, that goes to her constitution again. And my grandmother and all my grandmother's siblings, they all have type 2 diabetes. So my mother had that gene. And then her leg problem is part of the symptoms of her diabetic family history gene. So to solve that problem, basically it's the circulation issue in her lower leg, the inflammation caused by the circulation issue in her lower leg. So since I studied the stem cell when I was introduced to it, and I realized stem cells are very good at reducing chronic inflammation. And also maybe it can repair her vein a little bit. So why not try it? So that's why we tried it and then worked within the months to reduce the inflammation in her lower legs. So going back to that Sjogren's guy who has neuropathy, he actually said, because I didn't know any of this stuff until I treated him with stem cells. He told me he actually started having some circulation problem in her lower feet first, about 15 years ago. And then he actually had the laser ablation treatment for his vein, which did not work for him at all. And that actually started causing the symptoms, the neuropathy symptoms he has been experiencing for the past 10 years. And then when I was treating his feet, I realized, wow, his feet are purple. So basically he has very poor circulation as a result of the laser ablation treatment he got for his circulation issue. So, so everything, you have to really understand the mechanism, and you are trying to see whether any treatment can address that root cause. So that's basically my principle. And even those things like we don't really understand very well, but if we have some understanding, it's worth to try it if the direction of the treatment is the right direction to treat the root cause.
And that's very true. I think too often people don't realize that a lot of the treatments cause the next problem, which then causes the next treatment, which then causes the next problem. Especially the elderly, they end up on 20, 30 meds until somebody sits down with them and says, what are we doing? And cleans it all up. And once you clean it up, you get down to a handful of meds and most of the problems go away. But it's very rare, I've noticed in Western medicine today, for somebody to take total control of your health if it's not the person themselves.
Yeah, the problem is most people, they trust their doctors. And their doctors are trained in this disease-oriented, symptom-oriented system. So they don't really treat the root cause. Just a good example of this guy. How come all the neurologists, they didn't look into his autoimmune condition causing his problem? And after I treated him with stem cells, of course, I recommend him to do the treatment directly into the ganglia in the lower back where the root of the problem is. But of course, even though he's open to try stem cells, he's not that open to try this drastic treatment first. So he actually wanted to do the intravenous infusion of stem cell to reduce the whole body inflammation first. And then he wanted to do the local injection into her feet because he thinks that's where his problem is. But of course, once I treated him, I realized, his feet are totally purple, which was even worse than what my mother had 5 years ago when she started having the treatment for her leg. And of course, combining some stem cells to treat the circulation in his lower feet would alleviate some symptoms because his feet are totally purple. It was just, I was thinking, if he keeps going on like this, he would have ganglion and eventually had to have amputation, just like what I think my mom would ended up with if she didn't have the stem cells. And I also knew other people who had the similar condition like my mom eventually had amputation. So basically, if you only trust your doctors and you yourself really don't have enough knowledge to understand these things, to explore yourself, then basically you're at the mercy of what doctors tells you to do. And then basically you ended up taking 100 medications and then they canceling out each other and then they don't do anything and they cause more problems.
No, that makes total sense. You have to, and that's why I think you have to take control yourself of your health. And then you can go have these conversations with different people and figure out what is actually best and what works. But if you're not taking control, I think that's a big part of the problem. What are some other ways that you've used stem cells to help people?
I would say 70% of cases, people looking for stem cells are for joint, muscle, tendon issues. And a lot of them, they have osteoarthritis of the knees, shoulder, hip. And some of them already have one joint replaced. And because they had very bad experience with the joint replacement, and some of them didn't want to do the other joint. So that's when they were looking for stem cell treatment because they didn't have any other options. Because for those kind of conditions, steroid injection doesn't work any well. And then what else do they do? Just put up with the pain, taking painkillers. So that's when people call saying, oh, I have shoulder issue at joint. So that's the 70% of the case. And then the other 20%, a lot of people with Parkinson's, they are looking for stem cell treatment. And then other autoimmune conditions like rheumatoid arthritis, lupus, ALS, these type of conditions.
Are you doing any work in the longevity space?
Yes, I do. So I'm always into longevity. And I think because one of the principles is early prevention. So you don't want to wait until you're 65, 70 to think about, oh, I really need to do some longevity treatment for myself. So I'm 51 and I have been doing stem cell treatment for myself in the past 5 years because I want to slow down my aging process and prevent aging related degenerative conditions. So I've been doing it to myself. So that's why I stand behind the quality of my stem cells I offer to people, because I've done it myself 30 times. If there's anything wrong with my products, I will be the first one who have any issues.
Are you doing anything beyond stem cells for longevity?
Yes, I do, because stem cell is not a single magic bullet. Stem cell is more like a jump starter or like a boost to your body to help your body to regenerate itself. But you need other, like I said, the sixth principle is you need to combine all the modalities that's suitable to your body type. So, for example, the stem cell is not going to treat my silent acid reflux or my valve issue in my esophagus. So you need to combine different things to treat your body. And stem cell is powerful, but it's not a magic bullet. So what I do besides doing stem cells regularly, like once every 3 to 6 months, I also do red light therapy every day when I can. I also do infrared sauna. And I also started doing some glutathione treatment. I do nitric oxide treatment. I'm actually looking into getting a hyperbaric chamber as well for my clinic. So I can help people recover faster after the stem cell treatment.
So a whole host of things.
Yes.
Is there anything on the health side that we should have talked about but didn't get a chance to?
That actually goes to the emotional wellness or the mental wellness. Even though we start talking about mental well-being in Western medicine more now compared to, say, 10, 20 years ago, we're still not really addressing what we need to address in the mental wellness. Because a lot of people just tell you, oh, we need to do meditation, we need to do this, do that. But the root cause of a lot of people's mental issues cannot be solved just by doing 10 minutes meditation following the app on the phone. They have to profoundly change their view of life and a lot of other things that we don't really teach about. And that actually is a philosophy taught in Taoism, which is the foundation of traditional Chinese medicine.
And what exactly is that?
So that goes to the fifth principle of following the natural flow. So all the unhappiness in life comes from comparing yourself to other people. So in our modern society right now, we have social media. So many kids, they are unhappy because of social media influence. It's because they are comparing themselves to people they see on social media. A lot of them are unreal and fake, but they don't know that. So basically, if you recognize your own body, not just from the health wise, but also in your capability, in your career, in your study, then basically you need to recognize your body as a unique composition. And then you need to address your strengths and weakness in your career, in what you pursue. So that's actually the essence of Taoism. Basically, you need to recognize your own body, and then you need to pursue something that you have a passion for, and you also have a talent for. Everybody has different talents. Like I can never play badminton or play volleyball because I just lack that capability to judging where the ball goes. My father was a very good badminton player when he was younger, and he could beat anybody, but he was trying to teach me badminton since I was 2 years old, but I just couldn't do it. No matter how hard I try, it's not something you just can obtain through practice. So that's why, everybody has their talent. So you have to recognize your own talent and to really manifest your capability through your talent, not trying to follow somebody else's path. So everything in health, in career, in your life is the same rule.
Yeah, you have to figure it out for yourself. And that is one of the things, understanding what you're good at, what you're not, being okay with it, and then focusing on the things that you can do well, and just understanding that there's some things that you just may not be designed for. So either come to accept it and have fun, or let somebody else do it, and
Exactly.
move on with life.
And also in the process of pursuing what you're good at, you also need to recognize that it's not about the end result. It's about the process of pursuing it. So the meaning of your life actually lies in the process, not in the end result. And you will never have an end result. And on the other hand, you cannot compare yourself, what you are at, to somebody else, because everybody's different and everybody has their own strengths and weakness. So why do you want to compare yourself? So if you keep comparing yourself, that's what causes the unhappiness, right?
And that's a big problem in today's world of social media.
Exactly.
Is just learning to turn it all off and be happy and enjoy life.
So even people talking about mental wellness or meditation, most of them, they don't talk about this, right? They don't talk about what's a root action you need to take to address the root cause of your unhappiness.
And that is the key. Everything comes down to figure out the root cause and then fix it. And then you won't have to deal with most of this stuff.
Exactly.
It's time to learn the secrets of life.
What's one truth about success you wish more people understood?
Okay. So success is not measured by what you achieve. Success is measured by your own capability of pursuing what you want to pursue, and you have the meaning, you obtain the meaningful life from pursuing what you want to pursue. But it doesn't necessarily mean you actually achieve to where you want to go.
You have to be clear on what you want. What did you learn later in life that you wish you would have learned sooner?
That part is difficult to say, because I feel I really learned a lot earlier in my life, including Taoist philosophy, because that was not taught in the school in China. So I guess I wish when I was younger, like you asked me about the lesson about money when I grew up. So I wish when I was in my teens or 20s, I could have learned more about investment, because I actually learned about investment later in my life, maybe around 40. But, that wasn't too late. It was good. But I wish if I started much earlier, it would be even better, right?
Very true. If you were to give an 18-year-old one specific piece of wisdom, what would it be?
I would tell them to read the Tao Te Ching, which is the Taoism book from 3,000 years ago. And it has all the essence about what we talked about today. about, treating the root cause, early prevention, recognize your own body's uniqueness, and address your own body's uniqueness.
And I do very much like reading it. If people would like to learn more about you, your book, your services, how do they find you?
So if they want to pre-order my big book, which is actually coming out in a few months, they can go to book.regenerationeffect.com.
Okay.
And I already published the abridged version. So I also have the 6 pamphlets about the 6 principles. So for people who have busy lives and they don't have time to read big books, then they can actually get 1 free ebook download for the 4th principle, Tend Your Body Like a Garden, at gift.regenerationeffect.com. And if they want to learn more about stem cell treatment and all the other things I do, they can go to my podcast, Stem Cell Talk, and they can find that at stemcelltherapyexperts.com. And also I have another podcast called Regeneration Effect, mostly talking about the philosophy we've been talking about, and also red light therapy, other therapies like DNA testing. So that is Regeneration Effect podcast. So you can find all these podcasts on all the platforms for podcasts.
And people can check it out if they're interested in learning more. Thank you so much for joining us today.
I'm so happy to share the deep philosophical ideas we both have at today's show.
Everything Dr. Song described today comes back to one discipline. Ask what is upstream before you treat what's downstream. This really applies to your body. It applies to business. It applies to unhappiness. Most people carry without knowing where it actually comes from. The question she left me with, and the one worth sitting with tonight, is this. What are you managing right now that you've never actually diagnosed? If this conversation was helpful for you, share it with someone else that you think it might be helpful with. You know where to find Dr. Song? You can find me on LinkedIn. We can continue the conversation. Thanks for listening. Have an abundant week.